Welcome to continued discussion about depressive disorders. In the last module, I said we were going to move on to the bipolar disorders, but I had not completed the last few of the depressive disorders. So in the last module, we discussed disruptive mood dysregulation disorder and major depressive disorder. In this series of slides, we're going to delve into persistent depressive disorder and premenstrual dysphoric disorder. These are the primary diagnoses, and then, of course, the substance medication induced and other specified we'll get to also. We're going to start with persistent depressive disorder. Persistent depressive disorder is really, as the name suggests, it's a depression that persists. Now, in the DSM-4, this particular diagnosis was referred to as dysthymic disorder. It meant this was depression that was at a lower intensity. So the depressed episode here really stretches out for at least 2 years. So whereas we talked about major depressive disorder as happening in episodes, this becomes chronic, right? And so the experience of the sadness lasts for at least 2 years, and that's for adults. If it's a child, for just 1 year, and it's present for most of the day, just like with depression, except longer, persistent, chronic in nature. So if we're thinking about this in a person, this disorder might describe somebody that's blah, melancholy most of the time, and that's their general mood, okay? Versus somebody who has major depressive disorder, where they may be neurotypical in their usual demeanor and then have these dips into depression. Because of the length, it's chronic in nature and is distinguished from depressive episodes, which you'll remember tend to last from 2 weeks to 3 months. This is a 2-year period of time. Onset for, I was going to say dysthymic disorder, but onset for persistent depressive disorder usually begins in childhood or adolescence and may be from those environmental causes in the family structure when there's an early onset, okay? It doesn't have to onset early, but when it does, it's usually that environmental family structure system that tends to impact depression presenting so early in a child. Now, like disruptive mood dysregulation disorder, it creates impacts socially. However, and maybe like DMDD, because there is no abatement to the symptoms, we can understand how the social and the occupational impacts can be that much greater than what we might see for just a depression, right? It has the potential to tax a relationship differently than a 2-week episode of sadness. Essentially, persistent depressive disorder is a less severe form of depression, but it has a longer duration and is less intense. Hopefully that is making some sense to differentiate the two. You may see a person who just seems to be down. I mean, the mood is just sort of bleak most of the time, right? Versus somebody where that is not their usual presentation and they have these episodes or spurts of sadness. Now let's move on to premenstrual dysphoric disorder, which is the final major disorder in this grouping, apart from the substance-induced and other specified. Premenstrual dysphoric disorder occurs during the menstrual cycle and is severe in its emotional impact. The The asterisk here is its emotional impact. So this is occurring or occurring in concert rather with the mood shifts. Might be some anxiety, physical incapacity, right? Now, a lot of people think what really distinguishes premenstrual dysphoric disorder from premenstrual syndrome, PMS, right? It's the dysphoria. It is the addition of the mood component that makes the difference, okay? Now, a lot of people don't like that this has been added because it seems to pathologize a normal female bodily occurrence, sort of reminiscent of over-pathologizing women's moods that we've seen historically, right? So for some, there's some pushback against this. But the addition of premenstrual dysphoric disorder was intended to really shift focus away from just the physical ailments, which can be undermined, the physical ailments of PMS, the headache, the bloating, the cramping, that sort of thing, to the mood changes that result for many during the menstrual cycle. So it was meant to legitimize that experience. When a woman says, these are the constellation of things that happen to me around my period, it becomes legitimate as a thing, not just the physical symptoms that go along with, and you're just making too much of it with a PMS when your mood shifts or you get irritable. As with the other disorders, qualifying symptoms must be present. In this instance, 5 symptoms must arise prior to the onset, that abate after onset, and then are absent after the menses. So notice how this disorder groups the symptoms just before, right? They start to abate after onset, and then when the menses has completed, these set of symptoms are gone. This is not a woman who is suffering with mood issues except around this time, okay? So the first grouping that I have on this slide, the second grouping is on the next slide, but the first grouping to get to that 5 symptoms includes the lability, the fluctuations in mood. When we say lability, that's what we mean, mood fluctuations. Sensitivity is present. There's a tearfulness, sudden sadness. There's also a marked irritability or anger or agitation that results and could even increase the likelihood of conflicts with other people. The depression is also significant. There is hopelessness or self-deprecation. There is tension that is appreciable. Anxiety, being on edge, okay? So this is a grouping here. You need one or more of these to get us to the 5 symptoms that are needed to diagnose this for a person during a menstrual cycle. The additional symptoms to comprise the 5 include things such as the decreased interest in usual activities, for example. Again, this should sound similar to depressive disorders. There is sleep disturbance, changes in appetite, right? The difficulty concentrating, a lack of energy, feeling overwhelmed or out of control, or the physical symptoms that might occur as well, right? So you could have the physical symptoms here, but that's not the crux. You couldn't just have the physical symptoms because that gets you a PMS. It's the physical symptoms along with the mood-related stuff. And remember, mood-related disorders come with this shift physically, a shift cognitively, okay? So when we're thinking about premenstrual dysphoric disorder, it has onset prior, it comes on prior, just prior to the onset of the period. starts to abate after the period actually begins. And when the period ends, all of this disappears as well. Okay, so now we're down to the last two. As mentioned already, many of the categories in the DSM will have these similar diagnoses of a substance/medication-induced depressive disorder and the other specified. In order to be a substance or a medication-induced disorder, the substance that is the substance of, is the foundational substance, it has to have the capacity to produce depression or a reduced interest in usually pleasurable activities. So this couldn't be a substance that couldn't already produce depression and be a substance-induced depressive disorder. Okay, so there are lots of uppers, medications that get people high. We wouldn't give a substance-induced depressive disorder unless the substance or the medication that a person was taking had the capacity to actually create depression. The symptoms are going to be present during or soon after either a person becoming intoxicated with a drug or they're withdrawing from the drug. Okay, so that's how this one is diagnosed. It is a depressed mood where we say we know exactly what the cause is, and the cause here has to do with a chemical substance. Okay, hopefully that's clear. When we're talking about other specified depressive disorder, again, this is terminology that's going to be found throughout in the various disorder groupings. But for other specified, here we mean that full criterion for any of the disorders in that group. And we have disruptive mood dysregulation. We have major depression. We have your persistent depression, premenstrual depressive disorder. Full criterion is not met for any of these, but there are still considerable features that give indication to a shorter and less intense form of depression, right? Criteria isn't met, but we know there's some depressive something going on, so we will give it other specified depressive disorder, okay? So you may have people that come in and you say, well, I don't think this isn't lasting for 2 weeks at a time, certainly not going up to 3 months, but I am still noting that there is sadness and disruption, but it's less intense and doesn't last for that minimum of the 2 weeks that a depressive disorder would require. Well, it's more than 3 months, right? So I'm no longer now considering a major depressive disorder. I'm considering persistent, but it hasn't been going on yet for 2 years, but it's been pretty consistent for a year. Perhaps you'll give an other specified. If it's a child, of course, you could go ahead and give persistent because only 1 year is required. But again, they are in the categorization of a depressive issue, but they don't meet full criteria. That's where other specified depressive disorder would come in.